Professional athletes are prone to ACL injuries, which are caused by a hyperextension to the ligaments of the knee. ACL injuries make the knees less stable and can make sudden pivoting movements difficult. The pain due to these injuries can often cause professional athletes to watch from the sidelines as their body properly heals. Today we visit with Dr. Michael Meow, sports medicine orthopedic surgeon, to tell us more about ACL injuries.
The ACL is a ligament that connects the thigh bone to the shin bone. The ACL serves to prevent the shin bone from sliding too far forward. An ACL tear allows that shin bone to slide excessively. An ACL injury occurs most commonly with a plant and twist type of maneuver. Occasionally it will occur with a blow to the knee. When you have an ACL tear, typically you'll notice a pop and immediate swelling to the knee, difficulty weight bearing, and a great deal of stiffness. The treatment for an ACL tear depends on the degree of activity that the athlete needs to perform at. For an athlete that does not require high degrees of planting, twisting, or jumping, bracing or exercise strengthening is probably sufficient. More commonly, the high-level athlete that requires running, jumping, and twisting will need to undergo a surgical reconstruction to replace the torn ligament with a new piece of tissue.
Rehabilitation of ACL tears is very important, obviously. It's important to get you back to function, but it also should be a method of trying to reduce the incidence of it happening again, because it certainly can. The type of exercises that you should be doing following ACL tear are called perturbation or balance training. Perturbation means to perturb a surface so that they are wobbly, so they have to react quickly to those unstable type movements or quick movements, right, on this unstable surface. These are critical for ACL rehabilitation. Stand on one leg. This is on a hard surface, no shoes, and you should be able to stand in that position without swaying for 20 seconds. Now we're going to do it with the eyes closed. So you're going to stand on one leg, get your balance, and close your eyes. By the way, you should do it on both legs. One with your eyes open, one with your eyes closed on a firm surface. And then Dave, pull that piece of foam over. Now this really brings in more difficulty, because we're actually taking the sensors underneath the foot and we're kind of fooling them by being on a soft surface. So now you're more relying on your vision and your inner ear. Good, Dave. Now balance on that with your eyes open. And again, you should be able to balance for 20 seconds without swaying or doing those gyrations to keep you up. Last test is with your eyes closed, and this one you're probably going to see a lot of you guys and ladies out there going to fall over like Dave just did. The second thing is to strengthen the hip up and the trunk, because we need a stable base from which that knee is going to function from. Two exercises we're going to demonstrate for the hip is the deep external rotator strengthening and the abductor strengthening. This is an easy exercise really to do, and he's going to be, again, 90-90, so the hip is at 90, the knee is at 90. And again, if you are really weak, you won't even be able to put a weight on the end of this ankle. But he's going to bring it down as low as he possibly can, and then he's going to come straight up, Chris, as high as you possibly can, right? You want to avoid trying to bend the knee, because we don't want to get the hamstrings involved. We want the deep hip rotators. Find a weight that you can only do 6 or 8 reps with in 3 sets. Work up to 12 reps, 3 sets, or 15 max reps, 3 sets. And then drop back down to 6 or 8 and add more weight to continually stimulate that muscle to grow. The hip extensors and the hip abductors. And Chris is going to get both with this exercise. As you can see, he goes back into extension and then lifts his leg up. And then you just take a weight again, put it around your ankle, and he's going to slowly lower it down, right, to the count of 10, and then come on back up again. Again, you find a weight you can only do 6 or 8 times, a couple of sets. You work up to 12, 15 max reps, 3 sets. Then the muscle is strong enough that you can add more weight. Drop back down to 6 or 8 and add more weight and progress that way, constantly stimulating the muscle to grow.
Be sure to keep these tips in mind when you prepare for sports and want to stay strong and healthy. I'm Molly Sullivan with SportsMD.com. Remember, at SportsMD, health equals performance.